My friends, imagine waking up tomorrow morning with a strength and hardness you haven't felt in a long time. No chemicals, no cumbersome pumps, and no risky procedures. Just by using your own hands, plus a few minutes of simple but precise stimulation, your body can reactivate its natural erection mechanism. I'm Dr. Silvia Kharaisa, a urologist with over 10 years of experience helping men restore their sexual vitality. Today I am going to show you 3 specific pressure points on the penis and surrounding area that can help restore morning erections. These points work by increasing blood flow, relaxing specific muscles, and stimulating nerve responses. If you're missing the morning jolt that used to come automatically, don't worry. By the end of this explanation, you'll know exactly where these points are, how to safely stimulate them, and how often to do it for noticeable results. Why does this work? An erection isn't something that happens randomly. It's the result of a highly coordinated collaboration between the brain, spinal cord, blood vessels, nerves, and muscles. It all starts with a nerve signal, a small electrical message that travels rapidly from the brain or sensory nerves to the erectile tissue. This message tells the smooth muscles in the penis to relax, allowing blood to flow freely into cavities called the corpora cavernosa. As they fill, the veins that normally drain blood become compressed, trapping blood, resulting in hardness. However, as we age, conditions change. The blood vessels in the pelvic area can lose elasticity, especially if there's high blood pressure, mild inflammation, or simply years of wear and tear. At the same time, nerve conduction slows. Signals that were once fast now arrive more slowly. This combination of slowed blood flow and diminished nerve signals is the primary reason why morning erections gradually disappear after age 50 or 60. Pressure point stimulation works like an alarm. When you press or massage a specific point, you activate a cluster of sensory nerve endings that are directly connected to the reflex pathways that control erections. These signals not only stop at the local area, but also travel all the way to the pelvic nerve plexus and even to the sacral spinal cord where the erection center is located. A chain reaction ensues. The smooth muscles of the penis are instructed to relax, arteries dilate, and blood flows more rapidly. Some points even connect directly to the pelvic floor muscles, which support the penis during erection and control ejaculation. As a result, erections are not only easier to achieve but also more durable. First pressure point, the base groove. The first point, called the base groove, is located right at the root of the penis, where the shaft meets the pubic area. To find it, run your finger along the base of the shaft toward your body. It will feel like a natural indentation where the erectile tissue meets the structures attached to the pelvis. Beneath the skin in this area is a dense network of sensory nerves, including branches of the dorsal penile nerve, as well as a network of blood vessels that directly supply the erectile cavities. It could be considered a small control center where nerves and circulation meet. With gentle, targeted circular movements in this area, you send 2 messages at once. 1. For blood vessels, open and allow for faster flow. 2. For nerves, awaken and send signals faster. Place your thumb on the base of the groove, with your other fingers supporting it from behind. Apply moderate pressure, not painful, but enough to feel painful and slow. Circular motions. Warmth, tingling, or a feeling of fullness indicates increased blood flow. If you don't feel it yet, don't despair. Consistency is key. Best time, in the morning before getting out of bed, or during a warm bath to help the tissues become more flexible. If done daily, within a few weeks, the erection reflex can be retrained. Second pressure point, the perineum. The second point is in an often overlooked area. The perineum, the soft tissue between the scrotum and the anus. Although rarely noticed, this area is key to erectile strength. Why? Because just below it is the bulbospongus muscle, a major pelvic floor muscle responsible for constricting blood flow to the penis during an erection. With age, this muscle weakens if not exercised regularly. By massaging the perineum, you give this muscle a reflex workout without having to do a full cudgel. How to do it? Sit comfortably or lie down with your knees slightly apart. Using 2 fingers, index and middle, press gently but firmly in the center of the perineum. Move in slow, circular motions for 2 to 3 minutes. You may feel a radiating warmth or a subtle pulsation, a sign that the pelvic floor muscles are responding. For maximum results, combine pelvic floor exercises like cudgels after the massage. This will strengthen your muscles, making erections firmer and longer lasting. Third pressure point, corona glands. The final point is located in one of the most sensitive areas, just below the head of the penis. In the small circle where the glands meets the shaft, called the corona, this area has a very dense concentration of sensory nerves. Proper stimulation can enhance nerve sensitivity, making the transition from arousal to full erection faster. To do this, gently pinch the corona between your thumb and index finger. Hold for about 5 seconds, then release. Repeat this hold-release pattern for about 1 minute. Afterward, massage the corona in a circular motion for another minute. Don't press too hard, just enough to stimulate the nerves, without irritating them. With regularity, the nerves in this area become more responsive, helping restore morning erections and enhancing sensation during intercourse. Complete exercise sequence for best results. Perform these 3 points in sequence. 1. Base groove, 90 seconds of circular massage. 2. Perineum to 2 minutes of firm, circular massage. 3. Corona to 2 minutes of holding and releasing, then gently massaging. This total is only about 5 to 6 minutes daily. This sequence increases blood flow, activates supporting muscles, and sharpens nerve communication. Perlu dikataat, ini bukan tombol ijab yang langsung mengubah kondisi dalam semalam. Tubuh pada waktu untuk beradaptasi, meliti ulang pembuluh darah, audit. Dancer agar kembali sinkron. Naaman, sebagian besar pasien mulai merasakan perubahan dalam tubuh minggu. Tanda awal biasanya, rasa hangat. Di pagi hari, ereksi bertahan sedikit lebih lama, hingga muncul vitalitas lebih di area panggul. Untuk hasil jangka panjang, dukung dengan pola hidup sehat, cukup minum air, latihan dasar panggul, dan pola makan bergizi. Semua itu membuat titik-titik ini lebih responsif, aliran darah lebih lancar, dan tubuh mengingat kembali cara bekerjanya. My friends, weakening morning erections isn't an absolute fate of aging. Your body still has the natural ability to respond. All it needs is the right stimulation and support. By applying pressure to these 3 points daily, you can retrain your nerves, improve circulation, and rekindle your morning confidence without drugs or risky procedures. Remember, sexual health is a reflection of your overall health. Every small step toward better circulation and stronger muscles will have a positive impact, not only in the bedroom, but also on your daily energy. Thank you for watching. If this video was helpful, don't forget to like, share, and subscribe. See you next time. By Dr. Silvia Kharaisa.